Dr. Daniel here. Let's talk about glaucoma surgeries in the operating room. And this is really just an overview of kind of what's in my toolkit from a bird's eye view. If we think of the eyeball as having a faucet inside of it that makes fluid all the time and a drain inside of it that drains that fluid, that keeps the balance of making your pressure, there's the ways that we get the eye pressure down is we can work on that existing drain to try to make it work better. We can make a new drain for the eye that takes fluid from in the eye and drains it back behind the eye, gets reabsorbed into your body. Or we can try to turn down the faucet, the part of the eye that's making the fluid all the time. So first, working on the existing drain in the eye, a lot of these procedures fall in the category of MIGS or minimally invasive glaucoma surgery. At the time of cataract surgery, if you're on some glaucoma drops, for example, and you're a candidate for one of these are ways to work on that existing drain to get it to open up further or work better and get you off of some medicine and lower the eye pressure. About ballpark 75% chance these procedures work and lower the pressure, and 3 to 5 years would be a good outcome in terms of how long they last. There's a 25% chance that they just don't really do anything. So they're moderately effective. And minimally invasive, the main risk with these is some bleeding in the front of the eye. That usually goes away in a few days, just makes you a little more blurry. It's pretty unusual to deal with significant issues from the blood. And if someone has a significant bleeding risk on some strong blood thinners, there's a particular device that I can use that has a very low risk of bleeding. So minimally invasive, moderately effective in terms of most of the things we do on the existing drain in the eye. Let's move over to the faucet for a moment. So I can try to turn down that faucet that's making the fluid. This particular procedure is called CPC, or cyclophotocoagulation, and there's no cutting, there's no stitches. You are asleep for the procedure. I put some numbing behind your eyes, so you take a little cat nap for a moment for that, but you don't have to have a tube down your throat. It's very quick. It takes about 5 minutes. And I'm trying to turn that faucet down with the laser that impacts that structure. Moderately effective. Again, I'd say ballpark 75% chance that it puts us where we want to be, 25% chance it doesn't. It's very repeatable and very customizable. I've got several settings I'll use for this device. And the risk is according to how much energy I put into it. So I have a very low risk setting, and I've got some higher risk settings if we're really trying to get stronger efficacy. And then lastly, moving on to making new drains for the eye. All of these procedures are more in a little bit more invasive glaucoma. So we're putting a new drain in the front of the eye and draining fluid back behind the eye. These have a little longer recovery periods of about 6 to 8 weeks at least to kind of heal from the procedure. Most include stitches that do feel like something's in your eye. That's probably the worst part. It's very tolerable. It's just annoying to feel like there's kind of dirt in your eye or something as that stitch dissolves. But this would include a device called a Zen gel stent or a tube. There's several different types of tubes. These are different size tubes. And then there's a procedure called a trabeculectomy, which is the biggest surgery that I do. Actually, one of the oldest surgeries we have in glaucoma. Very effective, but that's the one that's most effective at getting a really low pressure, but is also one of the more high-risk procedures that takes a little bit longer to heal from, but it's a great procedure in the right situation. So those are the procedures where we're making a new drain for the eye. So again, we can work on the existing drain in the eye, we can try to turn the faucet down, or we can make a new drain for the eye. So generally speaking, working on the existing drain is minimally invasive, moderately effective. Working on the faucet can be minimally invasive and moderately effective, or a little bit more effective as I dial up the settings on that, customizable. And then these new drains for the eye I'd put in the more invasive category, but also much more effective. And so I'll give you the specific risk factors in terms of the chance of vision loss with any given procedure, depending on your specific anatomy and your specific situation. So hope that's just sort of a general overview that kind of gives you an idea of what tools are in the kit.